Yesterday's announcement by Governor Little, the one where he explained the dire situation facing our hospitals across the state, prompted a lot of phone calls and questions and even accusations from our viewers. Several of them curious about the ICU capacity based on what the governor said. Like this one, there are only 4 standard adult ICU beds available in the entire state, is a quote. Why doesn't that match the count of available ICU beds on the Idaho COVID-19 dashboard? It has 72 beds as available as of yesterday. And yes, that is what Governor Little said. As of yesterday, there were just 4 adult ICU beds available in Idaho. And yesterday, there were 72 available on the website. Today, there are 31. Before we consider that huge drop, let's talk about what that question is. It's still not 4 that the governor mentioned, right? But we'll let Idaho's Department of Health and Welfare, Elke Shaw-Tulloch, explain it.
The data that we have on our website indicate not just adult ICU beds, but it also includes pediatric ICU beds, and it also includes all beds total in the hospital. But what we really hear on the ground level is that ICU beds, of course, have to be staffed. They're short-staffed, so they can't necessarily use those beds if they don't have the staff to provide that.
Okay, so there's a lot to unpack there, but those numbers that she mentioned, they can change minute to minute, she told us. And what's available now, that can be filled 10 minutes later. And it's not instantaneously reported to the state website. Okay, so you heard her mention that. An ICU bed by itself, it's not going to cut it. That's not enough. They need nurses and staff to attend to that patient in that bed. And if they don't have that staff, well, they can't use that bed, even if it is listed as available. All of that, by the way, is written next to an asterisk on the state's website. Just got to scroll down a little bit, written right underneath. But none of that is good enough to convince a lot of our viewers about what is happening in our hospitals, like this one, from someone who keeps hearing about all the people in the hospital and in the ICU, who said, then I hear from nurses and other medical staff, there's hardly any people sick with COVID in the hospitals. So who's telling the wrong information? This has been going on since this all started. Is the government reporting false numbers for some kind of kickback? I'm not the only person thinking this. Okay, well then there's this voicemail.
Hi, I would just like to see you guys report the truth on the number of ICU beds available in the state after the governor's message today. It's not because there's so many COVID patients filling up our hospitals. It's because with the mandate for the vaccine, there are nurses and doctors quitting right and left. Quit using your scare tactics and report the truth.
Well, of course, that was an anonymous phone call. But let's talk about that. First, the truth comment. It's not as like we can just walk into an ICU and just start counting patients and beds and staff. So we have to rely on what the hospitals tell us to be true. What other option do we have? Also, there hasn't been anyone willing to go on the record with us to tell us what the hospitals are telling us is not true. We've tried. Can't find anyone. So just like us regular folk, let's explain this whole people not showing up for work kind of thing. Healthcare workers, they get sick too. They can either catch COVID or they can come into contact with someone who tests positive or just regular sickness. And in that case, well, they can't come to work. And if they get the COVID bug or they get close to somebody with COVID, well, they have to quarantine. And sadly, with this global health crisis stretching past a year and a half as it has now, and with Idaho hospitals coming this close to crisis standards of care twice, our healthcare workers have been asked to do a lot. And as we were told by St. Alphonsus Hospital, some of this shortage has been caused by burnout. People leaving the profession because, well, it seems to be never ending. As far as that walking away being attributed to the major medical providers requiring employees to get the COVID vaccine, that doesn't really seem to be the case either. When that requirement was announced, for example, we were told by St. Luke's their vaccination rate at the time was around 80%. As of today, they tell us 91% of their 17,000 team members have been vaccinated. St. Luke's, they're going to start confirming those numbers today. This was the deadline they gave employees to get that first dose. So it's going to take them a bit to get all of that review completed. St. Alphonsus, by the way, well, their deadline is September 15th, so they don't have those numbers available as of now. But let's look at it this way. Maybe this might help illustrate it for the doubters in the back. Think of it this way. Our hospitals, They're pretty big buildings, right? They got lots of space for lots of procedures, lots of things happening in there. And in most cases, in terms of space and staff, they're set up to handle a mass casualty event, right? And when faced with one of those mass casualty events, if need be, they can pull resources from one hospital or another to help fill in the gaps where maybe they can't call all of their staff in at once. But our hospitals, they aren't set up to handle a situation like that every day or for an extended period of time, which is kind of the situation we are in now. Except it's not just one hospital, it's all of them. One can't ask for help from another hospital because they're all facing the same crisis, and they can't spare the resources either. These are the facts. And if that scares you, well, maybe it should. This is a situation Idaho hospitals have never been in before, ever.